Hi everybody. I am starting my live chat just a little bit early, just to kind of set it up for you. I want to apologize in advance for my pets. I always feel the need to kind of apologize for them in these live chats because, as you can hear, they are very loud sometimes. They're always playing and running around. Guys? Come here. I'm hoping before the chat officially starts, and that was also my alarm clock reminding me to get ready for the chat. So basically, yeah, I'm just waiting till people hop on, apologizing for my pets in advance because when you have 3 dogs and 2 cats, they sometimes are noisy and loud and disruptive, and they like to kind of barge in while I'm doing these chats. So it is what it is. If you see a Doberman butt or a little Chihuahua mix jumping up here by my shoulder, or my pug making really weird noises, that is Brutus, Pip, and Maggie. And then I have 2 cats, Jack and Theo, who sometimes like to make appearances as well. But yeah, so I wanted to hop on a little early, just give everyone a chance to sign on. Again, apologize for any background noise. And I just wanted to tell you guys how this is going to work. If you remember, I did kind of like a town hall style Ask Me Anything Q&A session a few months ago, and it seemed to go over pretty well. I had a lot of participation. And the chat went on for about an hour, maybe even an hour and a half. I will stay on this one as long as you guys want me to, as long as there's some activity, people joining in and people asking questions. I will stay on. I have until about 8 or 8:15 p.m. To talk with you guys. I might have to hop up for 1 second in just a little bit to turn off my oven, so I apologize in advance for that as well. As you can tell, this is super casual, so yeah, so that's the premise. I'm willing to answer pretty much any questions you have. You can ask me anything. I will gladly tell you about my health journey. I will answer questions to the best of my knowledge about treatments and medications and alternative therapies. I will give you my opinions on things in medicine and healthcare and holistic treatments and living with chronic disease. So whatever you want to ask me about health and wellness, healthcare, patient advocacy, my own story, my books, my writing process, the autoimmune registry, my work with the Lions Club, my past work with the Arthritis Foundation, and my new endeavors with Creaky Joints and We Go Health. I'm here to answer any of it. So I am going to go ahead and I am going to open it up to questions now. I know we don't officially start for another couple of minutes, so you guys can formulate your questions and start leaving them in the comments section. I will answer the questions in order, and I will do my best to get to absolutely everybody. In the meantime, I will check on my dinner that's in the oven so that I hopefully don't have to get up during the live cast. Well, let's see. I will just put this on warm for now. That way it won't disrupt us. Okay. And let me make sure that my alarm clock is turned off because, like I said, I had it on to Okay. So, that's my dog in the kitchen throwing his water bowl around. Okay, we're close enough to 7 p.m. So, who is going to be brave enough, or whatever you want to call it, to ask the first question? The only way the question and answer chats work is if I get questions. So, I need someone to, I know there's some of you on there, I can see that there is. So, if anyone has a question for me, I would love someone to start it off. until then, until I get my first question, I will just talk a little bit about sort of what I've been dealing with lately. Sorry, I'm trying to set this up so that I don't have to hold it. So basically, as many of you know, I've had quite a journey with my treatments and my medications for rheumatoid arthritis and other autoimmune diseases and musculoskeletal conditions and chronic illnesses. This past year or so has been really tough for me. In November and December, I dealt with a thyroid cancer scare. And then once that all got straightened out, I was about to actually have my thyroid removed. I ended up being able to get a molecular study that told me it was almost certainly benign. So I was able to avoid that surgery, and soon after that started, I started Remicade, which is a wonderful drug for so many people, and so many people do absolutely great with it. But I unfortunately had a scary reaction during my second infusion and found out that I might be intolerant to anti-TNF drugs, also called TNF inhibitors. They are really common for rheumatoid arthritis and Crohn's and colitis and psoriatic arthritis and several other medical conditions. So that was really scary. My blood pressure and my heart rate were skyrocketing to near dangerous levels, and I had a lot of issues with flushing and hives, shortness of breath, abdominal pain, just one thing after another. So they basically think it was some kind of immunologic reaction, like an allergy or an intolerance or some kind of drug sensitivity that caused this. But they're also investigating me for something called carcinoid syndrome. I'm waiting on some test results for that and waiting to schedule a test for that. It's kind of scary. It would answer and explain a lot, but it's just one of these things that's really annoying because waiting for test results, waiting for answers is always one of the hardest things when you live with medical problems. You know, it's one thing to be suffering in pain or sickness every day, but then to have the mental and emotional stress and anxiety and worry of waiting for biopsy results or pathology reports or scan results or whatever, blood work, that part gets to be really trying and really tiring. So that's where I am right now, is in this place of just waiting for results and one appointment after another. I've probably had 30-some doctor's appointments in 2017 already. I've had, I think, 3 this week, and I will have 3 next week. The week before, I had like 3 appointments and a colonoscopy and endoscopy. This is on top of physical therapy and things like that, cryotherapy. So it's been a lot. I met with my rheumatologist yesterday, and we're trying to figure out what my next steps are going to be. I'm aiming to have a knee replacement. I was trying to wait till the fall, but I don't think I can wait till the fall anymore, so it's going to be sooner than that, I'm guessing. I just don't know when. I have a lot of trips and things like that I have to figure out scheduling-wise. In order to get that going. And I'm also still looking into stem cell therapy. I'm pretty sure that my right knee and my right foot are too far gone for stem cell therapy, but I want to learn about it to see if any of my other joints, to see if it may be a good fit for any of my other joints, and to learn about if I would be a candidate and what the pricing is and the payment plans, and kind of just learn about the science behind it, because I don't know how many of you know this, but I'm a huge science nerd. You know, it's funny because I'm a faithful person, I'm very spiritual, and you know, I'm a practicing Christian, but at the same time I'm fascinated by science. I'm a huge supporter of and believer in science and medicine as well. I believe in a lot of natural, holistic, alternative treatments and therapies, but I also believe in a lot of pharmaceutical approaches and modern science like stem cell therapy. So I really want to learn about that aspect of it as well. And in the meantime, like I said, I've been trying some more of the natural and holistic and kind of alternative stuff. My husband and I have been doing cryotherapy, which you basically freeze yourself to like negative 200 and something degrees Fahrenheit for 3 minutes. It's really interesting and you feel great afterwards. I've only done it twice. My third session is Saturday. I do acupuncture and cupping therapy and massage. I just got an LED light therapy pain relief pack, and I'm interested to try that. I haven't really tried it yet. I'm still doing my Tespo vitamins and my Monk therapeutic air, which are the portable essential oil diffusers that kind of look like vape pens. Or e-cigs, but again, they're not harmful or anything like that. They're not smoke. There's no nicotine or anything toxic. It's all natural and they're really awesome. And I still use my regular essential oils by doTERRA all the time too. So I'm doing everything I can to feel better. Since I can't take Remicade or Enbrel or really any of those TNF inhibitors anymore, I will likely be trying Xeljanz. Xeljanz, for those of you who don't know, is a daily biologic pill. And then with the Xeljanz, I will be doing either Areva or Imuran. If I don't do Xeljanz, I may try Rituxan again. Xeljanz is a JAK inhibitor, a JAK inhibitor, and Rituxan works differently than that or a TNF. It targets the B cells. Areva and Imuran are a whole different class altogether. They are DMARDs or disease-modifying drugs. For those of you who don't know, there are a lot of different types of biologics. So when someone says, oh, are you on a biologic? There's so many different classes of them. There's TNF inhibitors. There's biologic drugs that work on your B cells. There's biologic drugs that work on your T cells. There's JAK inhibitors, JAK inhibitors. There's a lot of them. There's even some biologic drugs that are actually chemotherapy drugs. So I feel grateful that for these conditions, there's at least a lot of treatment options. It's not great that I've exhausted a lot of the treatment options or can't take them or had a bad reaction to them, but at least I know that there are, treatment options out there. Now, I run into a little bit of a problem because I have juvenile idiopathic arthritis even though I'm an adult, and some of these drugs are only approved for adult onset rheumatoid arthritis, so that limits my options a bit, especially given my intolerance to the anti-TNFs, but it is what it is. So, okay, so now I've told you everything I have going on. I have warned you about my dogs, and I am ready for your questions. So, is anyone out there, does anyone have anything you want to ask about my books, about my health, about my experience with any of the treatments I mentioned, or the work I do with Healthline or the autoimmune registry or anything like that? If not, there were a couple people that had sent in questions through email, and I kind of jotted them down. Let me see if I can find them. Sorry, give me 1 second here. I'm dropping stuff. Okay. All right. Okay, Sarah asked me how old I was when I was diagnosed with RA. Well, technically, I was diagnosed with juvenile rheumatoid arthritis. Now it's known as juvenile idiopathic arthritis or systemic juvenile idiopathic arthritis. But back when I was diagnosed, it was called JRA, which is juvenile rheumatoid arthritis. The form that I had was polyarticular, and it now would be classified as SJIA, which is systemic juvenile idiopathic arthritis, or sometimes just known as JA, juvenile arthritis. I was diagnosed with that in late elementary school going into middle school, so I was around 5th grade, I think. I first started having symptoms of it in second grade after my first Holy Communion. I talk about this in my book, Sick Idiot, but it was almost like a little accident, a little fall, sort of triggered my juvenile arthritis, and everything went haywire since then. So my theory is that I probably was genetically predisposed to it. Autoimmune diseases tend to run in my family. They say that a lot of these diseases are not hereditary or not genetic, but I find that hard to believe given my experience and my family's experience and a lot of other people's experiences as well. So I think I was predisposed to having this, and that maybe the incident at my first communion party sort of triggered it. Someone accidentally pushed me down the steps, which was not the best day to remember my first, or the best way to remember my first Holy Communion. But yeah, I got pushed down the steps by accident, just roughhousing with some kids, and my ankle, swelled up like terribly and just never healed correctly. And, after a lot of ankle pain and things like that, and then terrible pain when I played softball, we realized I had to see a specialist. And around age 10 or 11, I was diagnosed with a JA by a regular rheumatologist, because at the time we didn't really know of any pediatric rheumatologists. I'm 33 now, and only very recently was I diagnosed with adult RA. Actually, it's just weird because some of my doctors write RA, some write JIA, and some write both. Technically, I'm rheumatoid factor positive. My anti-CCP is positive. All of the tests for adult RA are positive, and the Vectra DA test and everything like that. So, I have it. Maybe it started off as JIA, or maybe I still have JIA2, but I have RA as well, regardless of how my doctors label it. And they can all agree to disagree. It's been a big cluster trying to get treatments when they all write different things as far as the diagnosis. But I have osteoarthritis as well, OA. I should mention that I was talking about stem cell therapy. That's not indicated really for RA. It's not really for like inflammatory or autoimmune types of arthritis. It's more for osteoarthritis and other like bone and joint diseases that are a little bit more structural in nature. So good question, Sarah. Trying to see, I can't even read my own handwriting here. What medications am I on? Like I said, I'm in the middle of trying to figure out what medications to be on right now. I just stopped Remicade. I've been on pretty much all the anti-TNF drugs like Remicade, Orencia, Humira. Orencia is not an anti-TNF, but I've been on it. Remicade, Humira, Enbrel. I've done Rituxan, I've done methotrexate, I've done Plaquenil, all that stuff. So right now I'm just doing Celebrex and prednisone as needed, and a bunch of supplements. I take a muscle relaxer as needed, and a migraine medication, and I'm probably going to be trying the Xeljanz with either Imuran again or Areva. Does anyone else that's watching have any questions? I know some of you probably have something you want to ask me. It doesn't even have to be arthritis related. It could be related to anything. You could ask about my pets or my husband. The reason that I even bring him up is he is a personal trainer and a teacher, but he also competed on American Ninja Warrior, so people always seem to want to ask about him. That's my dog making some weird noises in the background again. Oh my gosh, they are so weird. I'm sorry, guys. Maybe I'm not seeing comments. I don't know if anyone is even asking questions or not. How about this? If you're out there watching, can you just leave a comment to test so I can see if the comments are showing up or not? Can you just say hi or something? Anybody, please? If you're watching, please say hello so that I know you're there. Because right now I'm seeing that people are on, but I'm not seeing any questions or comments. So if that's the case, that's a little bit problematic considering that I wanted this to be a question and answer chat. Can anyone, even just one person, say hi? I'm debating if I should stop and restart the chat. Huh. This says 10 comments so far. I just got an alert that says that, but I'm not seeing the comments. Let me see here. Sorry guys, I'm trying to figure out. This is so weird. It says conversation starter, 10 comments so far, but I'm not seeing the comments. Okay, just bear with me 1 second. I might have to stop this chat and start a new one. So if I do that, please hop on the new chat. I'm not sure why I'm having technical difficulties. This happened with my last chat too. I couldn't see the comments live. Okay, let me wrap this one up and I'm going to immediately start a new chat. So we'll try on that one. Hopefully I will see comments on that one, and if not, I will see if I can view these when I sign out. Give me a minute here, guys. I'm sorry.